The cochlear implant has been around for about 25 years in a more refined fashion in about 15 years. The cochlear implant is used in a patient who is totally deaf or darn near totally deaf. It's done under general anesthesia, and we actually implant a set of wires into the cochlea. It's done through the mastoid, and the wires are threaded through the cochlea, that little thing that looks like a snail in the inner ear, and then it's brought, the one part of it is brought underneath the skin via the mastoid, and then there's a magnet that attaches the two. So the sound is brought in from the outside, through the magnet, through the coil, into the cochlea. The results are unbelievable. We've seen many children born deaf. And if we can get them, hopefully by the time they're 1, or if not by 2 or 3, and do the cochlear implant, the results are fantastic, because those are children whom I knew for 25 years or 20 years in practice who would speak by 1, 2, 3, 4, 5, and their lives were awful. They lived in isolation, and it was terrible. Just a few weeks ago, I saw a patient that Dr. Reiser had operated 6 years ago. And I saw him in the office. I said, "How are you, Jason?" And he said, "I'm fine, Dr. Lippy," in a voice just like that. A voice that clear and you could understand it. I said, "What are you doing now?" He said, "I'm in 1st grade. I said, "Do you go to regular school?" And he looked at me like I was an idiot. He said, "Of course I do. I go to regular school." And I said, "Well, Jason, what do you like best about school?" And he said, "Probably lunchtime." And I said, "Why lunchtime?" And then he gave me goose pimples, because he said, "Because I'm in charge of answering the telephone in the principal's office." So here we have a 6-year-old that would have gone, and he's now in charge of answering the telephone in the principal's office. So the cochlear implant is a wonderful operation. On the other hand, I've known patients who have been hard of hearing. They were born with hearing and lost the hard of hearing for 50, 60 years. And they can talk on the telephone again. Mm-hmm. So the cochlear implant is great. We also have now, for the patient with an 80 and 90% loss, a totally implantable hearing aid. Now this is new, and there have only been probably 200 or 300 cases done. But this looks very promising for that patient with an 80 or 90% loss, regardless of what their discrimination is. Mm-hmm. We're limited in doing the cochlear implants to patients with total losses and poor discrimination. But the totally implantable hearing aid can be done with patients who do have some discrimination and an 80 or 90% loss. The last thing that's coming along that we're really excited about is the Maxim. And that we'll be doing within a month or two. And this is a semi-implantable hearing aid. All we're going to do is make an incision in the ear canal, and between Dr. Barinholtz and myself, we've done 30,000 operations where we begin by making an incision in the ear canal. And we're going to put a magnet on the top of the stapes bone, the stirrup or the stapes bone. Then we're going to introduce a hearing aid, let that heal, introduce a hearing aid deep into the ear canal. The hearing aid is going to drive the magnet, and this will be a hearing aid that you cannot even see, and it can be used for patients up to a 60 decibel loss. So here's an entirely invisible aid that's semi-implantable in an operation done under local anesthesia that we feel has marvelous, marvelous potential.